8:15 now. March is dedicated to spreading colon cancer awareness, and today we're delving into some of the ways in which you can reduce your risk of getting cancer and live a healthier life. We're joined by Dr. Elyse Bevier-Rawls with LCMC Health. All right, so we want to dive right into this. We've been kind of having a conversation between all of us during the commercial, because what we're finding is that we were talking about it. This used to be something you just expected maybe in older generations. You didn't think you had to worry about something like this, colon cancer, and now unfortunately we're seeing it in a lot younger.
Yeah, we're seeing it in a lot younger people, especially in people under 50. It's now the second and third highest rates of cancer within both men and women.
Wow.
So it's really important to talk about getting your screening and to really to do it at that time.
Yeah, something that we didn't have to think about before, that now we do. So exactly what is colorectal cancer?
So colorectal cancer is a cancer that starts anywhere within the colon. It typically starts within a polyp, so that's why surveillance and screening is really important.
Okay.
Because if you remove polyps, you can hopefully prevent the cancer, but it starts in a polyp and tends to grow from there, and once it gets large enough can potentially spread to other parts of the body.
Okay, so you talked about screenings. That's important to do. At what age should you start considering that?
For the average risk person, the age to start screening is at 45. That's for most people. However, if you have a personal history of polyps, your family has polyps, cancers, any inflammatory bowel disease, or any other genetic stuff, your screening actually might be a little bit earlier than that. So it's really important to talk to your doctor about what your exact risk is and if you need to get screened sooner.
Yeah, to know your family history, definitely important. And then what about treatments if you were to find that you do maybe have polyps or they are cancerous?
Yeah, so depending on where they find the polyp, if they're able, sometimes if they're small and they're able to get it removed completely, it may all be you need, and they catch it very early.
Okay.
Otherwise, the general treatment with a colon cancer is with a surgery, and then pending on the final results from that, whether or not there was any spread, would you potentially need chemotherapy. But when it caught early, the survival rate from colon cancer is pretty good.
That's good to hear.
Yeah.
That's good. So catching early is key. And what are some good habits just for trying to remain healthy and have a healthy colon?
Yeah, so overall having a good healthy colon, you want to have a well-balanced high fiber diet with a lot of fruits and vegetables. Try to limit your amounts of red meat and smoked meat, which I know is kind of hard here in Louisiana, as well as being active, trying not to smoke, limiting our alcohol intake. But other than that, can really help to have a good healthy colon.
Okay, these are very helpful. And again, this is the time to do it with March, all the awareness. Maybe talk to your doctor if you think that you fall into that category or you have a family history.
Yeah, absolutely. This is definitely the month, but any month of the year is a good year to get your colon, time to get your colon screened.
Thanks for joining us this morning.
Yeah, thank you so much for having me.
Very insightful. It's also important to note that the New Orleans Health Department's community health clinics, they offer screenings for people with or without insurance. We posted a link to our website that will bring you a list of clinics that could be near you in case that's something that you need to do.